was a blueprint for us, and it is a blueprint where it highlights the 5 big changes, game changers for us. And if we are able and willing to support these game changers, we will have a nation that will be self-sufficient in the future. Mr. Speaker, honorable members, I want to focus on the human capital development. But they say charity begins at home. I've heard my honorable members speak about health. And of course, health is one of the core keys for the human capital development. My name is Margaret Johnson. I have a background of health, mental health trained, and a psychotherapy master trained. Coming to Parliament, I feel there are things that we are lacking here that we need. We have staff members, we have quite a lot of staff and members of Parliament. But Mr. Speaker, honourable members, it's appalling that our health facility here is, I wouldn't say it's not existent, but it is lacking a lot of facilities. And it will be sad for us to be highlighting health and all the resources and input and percentage that we're having, but we haven't really thought about our Parliament health facility. And it's needed. It's seriously needed because we are all here, we're healthy looking, but there are people with physical health conditions and also probably psychological conditions that nobody is aware of. But God forbid we have an incident or crisis. How many of us here could say we are CPR trained or first aid trainers? Do we even have an allocated person for us to say that we could call if something happened? I've heard about the health facility, but I haven't seen it actually. It is not fully functioning. So, Mr. Speaker, honorable members, that is one thing I want His Excellency to be aware of, that we, as Member of Parliament, are asking for our own facilities to be remembered in this fight, in the human capital development and the revamping of the health facility. Mr. Speaker, honorable members, I represent 2 chiefdoms, the Bedobonge chiefdom and the Penguia chiefdom. The Penguia chiefdom is at the end, Guinea border. I am very happy that His Excellency in his speech is highlighting that the health facility is going to ensure that we have health facilities in everybody will have access to a healthcare center in a 3-mile range. I pray that our own chiefdom will be remembered. And I want to thank His Excellency because he has remembered one. And the health facility, by the grace of God, will be launching very soon this year in Penguia. Mr. Speaker, honorable members, I am passionate about mental health because it is one of my fields, and it is an area of mental health that is stigmatized, and it is not looked at fully because we have Disability Act, and our honorable colleague, speaking to our Deputy Minister, who was approved today, about revamping the Disability Act. But I've only heard one of my honourable members highlighted that our Mental Health Act needs to be urgently looked at. It is outdated, it is discriminatory, and it is of the 19th century. And we are in the 21st century. And we live in a country that have had severe crises and trauma events, from civil war, Ebola, mudslides. Most of Sierra Leoneans are living with this trauma. And we are talking about the drug use. But nobody has thought about the underlying issues of the significant increase of our drug use in this country. We've had civil wars, and that has happened. It was probably 20 years going now. We've had Ebola. People have lost their lives. People have lost family members. They are traumatized. And sometimes people use drugs to self-medicate. So while we're looking at legal framework to stop the drugs coming in, I want to ask and appeal to this, that we really look at the rehabilitation areas and an active campaign in terms of policies for the drug use. People who are suffering from it. You cannot just tell someone to stop drugs. Addiction is a condition and is a problem. There are various ways people are addicted to things. And I think psychologically, we need to be able to find a way how to help these people who are going through this. Mr. Speaker, honorable members, His Excellency in his speech talked about having every school-going children to have access to healthcare. Now, we have, at the moment, His Excellency has done very well for us in the healthcare, where he's recruited over 5,000 health workers. We have about probably 10,200 something schools, both primary and secondary. And if His Excellency is thinking and suggesting and putting this to His Excellency, let's think about hubs, accident crisis hubs in the highways. It will save lives. We do not, by the time you think about it, if we have fatal accidents in the Kenema Bull Highway, by the time somebody will move you out of your car, it is not the accident that killed you. It is actually the traumas that your body goes through before you get to the hospital. So we need to think about that. While His Excellency is thinking about having increased accidents and emergency services, I will recommend that he thinks about the main highway roads to have accident emergency hubs with trained nurses, nurse-led sometimes, but in the middle where it will be a 30-mile range from the point to hospital. And this will also help the communities around that area. We're saying access to affordable quality healthcare. These are things we should recommend to His Excellency to add, and it will help us, because every one of us do use the highway to travel to our chiefdoms, and some people do drive fast, and we've had a large level of road traffic accidents, and it will save lives. And so His Excellency needs to really think about that for us. Mr. Speaker, honorable members, I like to thank everyone for giving me this opportunity. Thank you